our meeting to order. And I see all who are here. So we will start with our ground rules from our Alder Jose. He is our paramountry. Is he here? Let's see. No. Okay. So our ground rules is that we will respect one another. We will follow the time that it takes, like a minute or a minute to say what we need to say. And most of all, just respecting each other. And I don't see our president, Madam President, for the Yale follow-up. So I will tell you the Yale jobs follow-up is they're going to hold a meeting next Thursday, January the 21st. That's their next meeting. Okay. Um, donation requests, which we are not doing. So now we'll go to our old business. Is Alder Jeanette Morrison here? Okay, not yet. Okay, so I will do that part for her. Okay, I'll let her come in. Okay. All right, the treasurer's report, she's not here for that. So I'll wait till she come in for that. Anyone here from our fundraiser committee? If Alder Rodriguez?
Well, how are you, Madam Chair? And Happy New Year. I know that Alder Ortiz and Alder Edwards and I go back and forth on conversations for different items. And I know Alder Edwards did call me earlier and she's going to jump on in that way. Hopefully Ortiz will be on as well. Everybody seems to be trailing behind. But we're hoping to bring up great ideas so we can get some revenue in.
Okay.
I know we discussed, obviously it's on hold because of the pandemic. I know that Alder Evelyn Rodriguez had mentioned, oh goodness. Oh my heavens.
It's okay. All of us, we're all there. I'm glad I'm not by myself.
No, I know we mentioned going to Mohegan and things like that. So there are several conversations. So if you don't mind, once Alder Edwards jumps on and Ortiz, we can definitely discuss fundraisers.
Okay.
There's probably things we can do during this pandemic to
Oh, God.
I'm sure.
Thank you, Madam Chair.
Okay. Thank you. How are you, Alder Wingate?
Well, how are you?
Oh, great.
Madam Chair.
Yes. All right. Alder Morrison is not here yet to discuss the gala, so we'll wait until she comes.
Are we
But
having
have some, pardon me?
Are we having a gala this year?
Hopefully, yes. The Lord allow us.
Okay.
Hopefully. Our new business is our Board of Alders agenda for January the 19th. Let's see, is our president here? Okay, so I will, our president is not here yet.
I'm here.
Okay, all right. Okay, good to see you. And we're doing the second readings for the Board of Alders agenda for January the 19th. We're ready.
Okay, the second readings is kind of self-explanatory. Under unanimous consent, we have the regular tax collector information. We also have um, automatic affair appointments under second readings, tax abatement, and then I think you guys passed over the community development item
Favor,
the last
favorable.
time. I haven't had a chance to talk to um, say that one more time.
Oh,
To
no,
see whether his intention is to pass over that item again or not. Um,
well, it doesn't say, I don't know, it doesn't say that we were gonna pass over it. It's,
yeah, no, it wouldn't say that. It
okay,
wouldn't say that up there. That's just something that we discuss and do. So, um, but you guys should be familiar with it because it was a second readings on the previous agenda. That's it, Madam Chair. Thank you.
okay. All right, did you want me to read about it or no?
No, I mean that's
Okay,
homework.
oh, okay,
People should this should already be done because it was the first reading already.
okay,
People either went to committee or listened to the report. There's no need to read about it. They'll
okay,
have it. We were supposed to vote on it already, so they should know about it.
okay. All right, thank you.
Make sure tell them that I'm waiting to get in there.
Yes.
Yeah.
Alder Santiago, Ernie Santiago is waiting to be, he's here, but he's waiting to come on, okay? Um, Black History Month. We have something new we would like to do. For our Black History Month this year, we would like to do a question and answer setting for ourselves and our community on the vaccine. And I would like to find out what do you think about this? Would this be good for our Black History Month? But this is what we have thought about and ask different speakers to come. We have asked Dr. Okafor, uh, Director Bonds, to be with us tonight, um, to be here to answer questions for us and questions that our constituents may have asked us on the vaccine. So, what do you think about that, everyone, for our Black History Month to have a question and answer on the vaccine to educate our community and ourselves? That's a question I've asked. Can you guys hear me?
Yeah,
Oh,
Alder Douglas, I think it's a great idea. Being that there are a lot of unanswered questions. I had a conversation early this week with Director Bond, and because
Oh, yes, please. I'm
somebody,
sorry. I can't multitask. I'm sorry.
can we mute our phones? There's
yes.
a lot of talking in the background. So yeah, I had a conversation with Director Bond early this week in reference to some calls that I got from some elderly constituents, 75 years and older, and they wanted to get some information and find out if the vaccination was available to them yet. And so I think that would be good to get those questions, those Q&As on the table. So
Oh,
thank
okay.
you.
All right. Okay. Also, we had business on the. We'll wait till
Can I add something to that, Madam
Forrest
Chair?
can come. I can hear you, Alder Wingate.
This is Alder Furlow. Can I add something to that?
Yes.
Um, I've been in contact with Taija, and she said that Director Bond is not going to be available on the
Okay.
26th.
Okay.
So that's something to consider. I am also I spoke with our president. That's fine. Thank you. I spoke with our president, and we're going to be doing a briefing with the alders regarding the vaccination. So I think it might be better to have Director Bond address us, the health director to get direct answers. I'm not sure what information Dr. Okafor will be able to provide as far as giving answers.
Hmm. Well,
Uh,
tonight she'll be listening to us, our questions, and answering to the best she know how. Well, they were just coming tonight just to talk with us as the alders. To my understand, Director Bonds was going to be here after her meeting, but she's not coming, correct? Alder
no, no,
Crowell?
no. I'm saying that she will not be able to make the Black History Month program,
Oh, okay,
so
okay,
she won't be available that day to answer any questions. So
okay.
we're going to be scheduling a briefing with her and the alders, so
Mm-hmm.
that the alders can submit their questions and then hear directly from her.
Oh, okay.
Can I can I add something?
Mm-hmm. Yes,
Um,
President.
Thank you, Madam Chair. So the briefing that we're going to be having is for all alders. The gist of this conversation and why it went to Black History Month to start off with is information for our communities and the Black and Latino communities to hear about the benefits of the vaccine, because as you all know, um, a lot of our people, they're a little nervous about taking the vaccine. So we want to supply them with all the information that is needed about the vaccine. And it is supposed to be a panel of people that have experience with it. I mean, we have to have someone from Yale Hospital
Mm-hmm.
or Hill Health Center or one of those places that will actually be administering the vaccine to people. I think that as many opportunities as we have to have information about the vaccine coming to our constituents is going to be vitally important. And I think that right now is some orders that have some questions. I think for the briefing for the whole entire board, it would be more questions coming up. But I think as the Black and Spanish Caucus, we have to help and assist in getting the information out to our communities.
Yes,
Thank you, Madam Chair.
yes, so true. Madam President, that is so true. And for the the Black History Month, that was going to be more than just one speaker, like you just said. I don't want to, reiterate. You did a very good job explaining. It will be others there um, for our Black History Month. But just tonight, I thought it would be good if we had our Dr. Okafor and Director Bonds with us just to share. They said they would um, answer some questions for us, for our residents and constituents. Okay, so
Madam Chair,
anything else around the Black History celebration?
Madam Chair, this is Alder Crespo, if I
Yes,
may.
yes, you may.
Thank you. I just wanted to add to the questions that have been asked. I know that from a healthcare standpoint, I know that for right now we're we're rolling out the 1A initiative, which is healthcare personnel, first responders, medical responders, long-term facility. So I've already received the vaccine myself, given that I work as a healthcare provider. But it's supposed to be sometime later this month that 1B is supposed to roll out for anyone who's 75 years or older, or our frontline essential workers. And then, of course, later in the year, hopefully sometime in the fall, 1C will be rolling out. So we got phase 1A that has already begun. So we've had multiple facilities such as the New Haven Health System, Cornell's Capital Health Center, for Haven Community Health Center. Given that I formerly sat as a board director, I have been informed that there has been multiple organizations already receiving the vaccine, but of course, the 75 years and older, to address Alder Douglas's question. I believe it's supposed to
Mhm.
start later this month for individuals 75 and older and additional essential workers. But of course, we received that information from the medical chiefs, and of course, we received that from the state. And so because I happened to receive that information, I just wanted to share with everyone here. Thank you.
Okay. And
Madam
while
Chair,
we're on this, I do have information that Al printed tonight also for us. Is where you can find information on scheduling your vaccine appointment. So they could go to, I'm just going over this with us, but I'm asked him to print this out so when I'm out, I could just give to people. And it says ct.gov/COVID vaccine. Appointments are available to anyone at the age of 75 and older, not only patient with existing relationships to the hospital system. And it says Yale New Haven Health said the system is currently finalizing plans for scheduling vaccines appointments. Hartford Healthcare and UConn Health went live Wednesday with online portals through which residents can make vaccines appointments. And it says Hartford Healthcare sign up is available at hartfordhealthcare.org/vaccine, while the UConn Health Portal is available. Their address for going online is mychart.uconn.edu/mychart/authentication/login. And it also says there are also phone numbers to call for help. Patients who prefer to make appointments over the phone may reach a Hartford healthcare vaccine helpline at 806-972-4993. And it says UConn Health asks everyone having trouble with online portal to call 860-679-44000. And it says, do not show up without an appointment. Do not show up without an appointment. On Thursday, the state will announce a central hub for vaccine appointments. ct.gov/COVID vaccine. To start the site will take appointments for anyone 75 and older. The state also established a phone hotline to help with appointment process. So this was given to Al, and Al, gave it to me so we could share with each other here tonight.
Madam Chair,
Yes.
this is Alder Morrison.
Okay.
Sorry for being late, just getting in from work, but I did want to say something about the Black History Program.
Okay, let's go back. Okay. You can.
Okay, so I'm not exactly sure everything that you've shared with the group, and I'm not sure if Dr. Okafor is on the line yet.
She'll come on a little later.
Okay.
After we finish our business.
Okay, but just so, of course, you know me, I started working on different things around the Black History Program. And so, as I'm pretty sure I told everyone that this year's event will be to look at the myths and the realities of the COVID and the vaccine. And so, and having this panel discussion that we're looking at and utilizing Dr. Okafor as the moderator, a couple of different people have been identified for the panel. So Director Bond will be on vacation on the day of our event. And so she's identified the nursing director, who is Dr. Jennifer Vasquez. And then I also talked to Cornell Scott, and they've identified one of the doctors there. I spoke to Dr. Tamiko Jackson, who's a pediatrician, who is willing to talk about the vaccination from the youth perspective. And then we're still working out getting someone from the state or from Yale to sit on the panel. And so I'm going to be talking to Director Bond again, and you guys, everyone is going to come up with questions. I'm going to talk to her about different questions, so we can have that. And at the same time, when we have the actual event on the 26th, allow the community to be able to ask any questions that may have not been asked. So I just wanted to let you know that since we talked earlier this afternoon, those are the different connections that I've made surrounding this activity.
Okay. Thank you. Would you like to do the Black and Hispanic Treasure Report before, and then also we were waiting for you for the Q House.
Okay. So in regards to the treasurer's report, Al was supposed to send me. He said
he did.
He did. I was logging on with my coat on, so
Okay.
I haven't been able to look at anything.
Okay. Well, I have what he sent you.
So, well, what I can do, let me just explain it, and then if you want to give the specific numbers. The bottom line, as far as monies is concerned, the only monies that we have spent was a check in May was written for $1,000 to the New Haven Scholarship Fund, and then a total of, I believe that was 2, 4, 6, 8, 12, 14, a total of $1,400 in checks were written last month to support the families on our board that had death in the family. We have always said that anytime an alder, excuse me, an alder has a death, we would give them $200 to provide some type of support. Unfortunately, we had 7 alders to have deaths in their immediate families, and we wrote those checks. And then we also last month wrote the check for $1,000 to the New Haven Hispanic Firefighters Society for their scholarship fund. They still had their scholarship fund, and because of COVID, none of the regular celebrations happened, but I was finally able to write the check out to them. Outside of that, there has been no other money spent other than like bank service charges. So,
Do you
that's
see
that.
the report Al put up for you now? Do you see
Yeah.
it? Okay.
Yeah. So as everyone can see, we currently have $22,684.16. As we all know, $10,000 of that money is our seed money for our gala. And so that's something that we don't touch. And then we did not give our 3 senior clubs their $1,000 each. Excuse me. And we haven't given out any donations after February. And so outstanding checks as listed here, the New Haven firefighters have not deposited their checks, and Alder Marchand and Alder Festa have not deposited their checks. And as Al has noted here, $1,000 for seniors, but that's really $3,000 because we give $1,000 to each one of the senior homes. And so, as he's noted here, available funds for obligations and outstanding checks, that number, he has $10,284, but you should add another available funds for obligations and outstanding checks. Usually we would have the $10,000 plus, plus we would say it would be the $3,000 for the seniors, because that's money that we're not going to touch. Oh, Al's doing it now. So that would end up being $13,000. And then the remaining. Reminder, older dues. So we're going to talk about dues in a minute. But one of the things that I wanted everyone to remember is that when we raise the money for the seniors and the youth, that's what we use it for. And so the monies that we take in as dues is the monies that we use when alders have, deaths in their families or, things of that sort. And so over the last 9 years, if every Black and Hispanic Caucus member paid their dues, we bring in about $2,200 a year just in that for alders. So I wanted to explain that so people knew that we're not taking money away from any funds that we raise through anything that we've done. We're taking money strictly from the monies that are provided by the alders. But when you get to dues, we can talk more about dues. But
Yeah, we have passed dues, and you're
okay.
working on the treasury report now, and dues.
I'm looking at Al's note at the bottom.
Okay. Yeah, that's what he got together for us for the treasury report.
Right.
Oh, he's sending you another note? Okay.
No,
Well,
at the bottom of the report that he wrote,
yeah,
he just wrote a reminder that the
Right.
dues are $10 a month. But I know you and I had talked about the dues and this being the new year. And I don't know if you guys talked about the suspension of the dues, especially for this year, until we come back together.
I was waiting for you to tell them.
Oh, okay.
You can tell them about it.
Okay. So before I go into that, did anyone have any questions about any of these baseline things that I just outlined for everyone?
No, I don't think so.
Okay.
I'm sorry, Alderman Morrison. I have a question.
Yeah.
So on the line of the funds on hold, there's $3,000 for the seniors. Right. What about the money for the youth organizations or entities? Where's that showing up?
We gave that money. We already gave that money. That's what I just said. The 2 checks that we wrote was one to the New Haven Scholarship Fund and one to the New Haven Hispanic firefighters. Now there is actually, Al, you might want to add one more $1,000 to this outstanding.
Because I don't see it. I don't see it as written as the youth. All I see is the firefighters.
Right. So the firefighters, we all know that's for the youth, right? He only listed the firefighters here because they have not cashed their check. But we always give $1,000 to the New Haven Scholarship Fund, which they've been cashed that check back in May. And they also they sent a thank you card. Alder Clyburn, you should have that. And then this is the second $1,000, the New Haven Hispanic firefighters. And then there is one more $1,000 that we call that like the wild card youth youth donation. But we have not identified what donation. You know, some years we have given it to Alder Smith when she worked for the city for the Christmas program that they've had.
Winter Wonderland, yeah, I got
Winter
it.
Wonderland. Another year
Right.
we gave it to Pop Warner. So
Right.
there is that $1,000 that's open.
It has not been designated.
That $1,000 has not been designated.
Is it open for us to apply or to apply it to some organization? Is it open?
Well, we as a group, we decided that we weren't going to give any donations other than those 2 scholarship donations. So that's up to the group. If you guys wanted to do something, you know, have people apply or what have you for that $1,000. But I know as a group, we way back had said that we were going to give the $2,000 out to those 2 scholarship funds, and then the rest was like funeral stuff. Okay. So that, I think that should be another conversation.
All right. Okay.
About that.
All right. Okay. All right. Thank you.
Excuse me, Alder Prescott, Alder Jose. Crespo, can you please keep the queue?
Sure.
And remember, you know, our time for our speakers tonight. So, okay.
So far, I don't see any hands raised.
Okay, very good.
Okay. So then I'm just gonna go over to the dues. And again, I guess at some other time we'll talk about that $1,000. But in regards to the dues, as it's noted, as we all know, dues are $10 a month, which results to $120 per year per Black and Hispanic Caucus member. And so, as we know, you know, a lot of people are real good with paying their dues. Then you have, you know, life gets in the way for a lot of people also. And so last year was really rough as far as dues collection. And I know at one point we suspended the dues. So because this is the first month of the year, and usually this is the start of the $120, I wanted to make a proposal that we continue to suspend the dues for this year. And when we have been given the permission to come back, you know, meet in person, that's when we start to do. So for example, if they say like in September, they're like, okay, the virus is over, go back to however, you know, meeting and all that stuff, then that September you bring $10. And so for this particular year, each person would end up paying $40 for the year. And so, I'm saying that, but I do want to make a motion around that. And so I don't know if people want to talk about that first before I make a motion, or how do you all want to handle that?
So, Madam Chair.
Excuse me, hello? Can you hear me?
I hear you, Ernie.
Okay, I think somebody has to make a motion before.
Yeah, okay, well, I'll make a motion. I make a motion that we suspend the 2001 dues for the members of the Black and Hispanic Caucus until the pandemic is declared over, or until the rules are lessened in regards to us coming back together.
I second that one.
Just a point of clarification. Did you mean 2021 or did you mean to say 2001?
2021. I didn't say 2001. No.
Yeah, I was like 2001. I don't know what that is, but yeah, okay. Just Just wanted to make sure.
Yeah, for 2021, and I'm gonna adding to that motion, when they do allow us to come back in person, even if we decide to keep these meetings Zoom, for whatever reason, that's when dues payments will start, but it will just start with $10. So that's my motion.
I second that one.
So,
Okay.
Madam
All
Chair, the
in
motion.
favor? Oh, there's someone. Okay.
Well, we need
Uh,
discussion first.
But you
So
gotta have a
okay. There.
discussion, Delphine.
I
I was
see. Alder Crespo is
I
taking care
was
of that, right?
I was gonna say, Madam Chair,
Okay.
that as far as right now, I don't see any hands raised
You can,
for discussion. I see one hand now, Alder Carmen Rodriguez.
So just to clarify, are we saying we need to be up to date for the 2020 dues and then moving forward so that we can clarify, because there was a lot of discussion during, before we closed the year, that 2020 dues still
I
needed,
got you, Alder Santiago.
Right.
dues needed to be brought up. So the two-part question. So are we going to ensure that 2020, we are up to date with our dues, and moving forward 2021, we are then going to start, once we go back live, on paying our dues of $10 a month. So I'd like clarification on that.
So yeah, the clarification to that, and thank you, Alder Rodriguez, for that question. So the clarification is exactly what you said. Because things were so rocky with a lot of us during 2020, we need to get up to date with our 2020 dues. So my motion was to stop the dues right now. When we're able to come back, and like I'm just using September, when we're able to come back as a group, dues will start at that point at $10. However, folks that owe, you're gonna have all this time, at least the next 6 months, to come up with the monies that you owe for 2020. So if you don't owe anything, you don't got to worry about it until we start having our in-person meetings again, or it's declared that we can have in-person meetings.
Okay, thank you so much for that clarification. I just wanted to make sure that those that, if that we need to be up to date for 2020, and you are going to spend 2021, so that gives us a bereavement moment. I hate to use that word, so that we can come back on track and be healthier financially moving forward. So thank you for that clarification.
Yes, and also just
I
to
would like
add to that.
okay, excuse me, Alder Morrison. Alder Frollo, you correct me, but if I'm wrong, our guest is on the line now. They're coming in. Al told me they're ready to come in. Director Bonds, and I got an okay for Dr. Okafor. Before you came in, Alder Morrison, we was talking about they were going to come just to answer some questions for us and for our constituents and us about the vaccine. So correct me, Alder Frollo, if I should stop now this part of our business and go forward and bring in our guests because of their time.
Well, Director Bond is in the waiting room. She is waiting, but whether we continue or not, that's up to you, Madam Chair.
Okay, well, I didn't want you guys to work on me.
But Madam Chair, we're in the middle of a vote.
Okay, well, I mean, after this vote, we will go.
Madam Chair, before we cast the vote, I know that Alder Santiago had his hand raised.
Yes, I said, right. Okay, Alder. Okay. Thank you, Alder Presco.
I lost everybody. Can you guys hear me?
Yes.
Okay, I can't see nobody. If you can see me, I think Alder Morrison answered my question. Just wanted clarification that all dues are now forgiven. It just got to be paid, and we're gonna stop until we get back in person. I just want to make sure But before I asked the question, it was already answered. So thank
Right,
you.
we're not forgiving anything. We're just as
Exactly.
Elder
That's
Rodriguez
what I
said,
say. Yeah.
yep, is a
Okay.
bereavement. I like that word
Yeah.
for this
Deferral.
situation.
Deferral.
Right,
Unless they want to go to tax abatement, and I can forgive it.
Right. Yeah.
right.
Yeah.
Are there any other questions? Because I
Uh,
know that you're pressed for time, Madam Chair.
okay.
Thank you. Thank you for the clarification, Madam Chair.
Madam Chair, that
So
was added
frozen.
for anybody else with their hands raised.
Oh, okay. So do we all agree that we will let our guests in? And
Got to do the vote, Madam Chair.
oh yeah, okay. Forgot about the vote. Okay, let's do the vote and then we will let our guests in because they did take their time to come to us.
So just say all in favor.
Okay, so all in favor?
Aye.
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 Okay,
Aye.
okay, nay.
Aye.
Oh, I know we're not going to do any discussion. So all in favor? Aye. And any
Aye.
nays? Okay, so the ayes have it. Is that correct, Alder Furlow? All right.
I think we're good enough.
Okay, good enough. Okay. So do we all agree that we will let our guests in to speak with us and then we will come back to finish our business? Is
Yes, ma'am.
that okay? Okay.
All right by me.
Okay. Thank you, Director Bonds, for being with us tonight. We want to tell you thank you. We honor your time and we wanted you to come tonight to answer some questions that we may have concerning the vaccine.
Okay, great.
Mhm.
Do you want me to do good evening, everyone, and thank you for the invitation. It's great to see all of you. I hope everyone is staying safe. It was great to speak to you earlier, Alder Morrison, and some of the things that we're working on, that you are all working on. I'm really excited to see some more partnerships and collaborations with this group and other alders in the very near future as we continue to roll out the vaccine campaign. And I do have a prepared presentation, or would you like it to be more Q&A?
I would, for our alders, if they have some questions, let's see what they have.
Yeah, let's start with Q&A,
Okay.
and then we can save the slides for when we formally come in a few
Okay.
weeks.
Yes. Okay, Alder Wingate.
Hello. Thank you, Madam Chair. How are you, Doctor?
Director, but speaking into existence.
It's okay, you know. But yeah, I'm calling. I mean, I want to ask a question in reference to the vaccination. How long does it keep the immunity up once you get vaccinated?
So right now, the vaccines, there's two types of vaccines that have been approved through the FDA and the emergency use of authorization, which is the Pfizer vaccine, which is for 16 years of age and older. Efficacy of, we know what the efficacy rate is. However, we do not know how long the protection factor can last as of yet. However, for Moderna vaccine, that is for 18 years and over. And we just received a scientific report earlier this week that that vaccine does guarantee a protective factor of 1 year. Both the vaccines have very similar efficacy rates. One is 94, one is 95%. One is, the major difference between the two is one has to be frozen and the other one can be refrigerated for a longer period of time.
Okay. So a person like myself that had coronavirus, right, by the grace of God, went through the coronavirus with all the symptoms and all that. You know, what would you say to a person like myself about the vaccination, taking it? Does it give it an extra layer? Should I not take it because I had it and have some immunities to it? right? What
It's
would be your
actually a really
suggestion?
common question that we get. That's actually a good
Mm-hmm.
question. And it's
Mm-hmm.
very common because people say, well, what about if I had COVID already?
Mm-hmm. I
COVID-19.
have a lot of good questions, by the way. I keep
Oh,
coming up with
good.
good questions.
Well, you got to give other people an opportunity to ask
Okay.
questions.
All right. Go ahead.
Sorry, I'm not the chair. See, the chair's going to have to regulate. No, I'm just kidding. So no, what we know and the scientific data has told what we know for research is that those that have had COVID-19 in the past, and by the way, thank you for just openly sharing your testimony when you did recover, and I'm glad that you were able to recover.
Thank you.
Because COVID does the long-term effects are still unknown, and we know that many people unfortunately have passed away and had untimely deaths to this pandemic. However, we do recommend that individuals may still benefit from getting vaccination. One thing we do know is that we now have 2 additional variants that have been introduced to the community. One in specific has been identified in New Haven County of 2 individuals that traveled outside of Connecticut and tested positive for a new variant. And the vaccine currently is known to protect against that particular variant, which is known as B.1.1.7. So yes, we do recommend that you get vaccinated.
Thank you.
Any more questions, Alder Wingate?
I would yield the floor, Madam.
Okay.
I would
All
yield
right.
the floor.
Madam Chair, I noticed that Alder Douglas had his hand up for questions.
Okay.
Okay. All right. So my question, Director, was I did ask you the other day. Persons 75 and over. Now, can you explain that A and B? What is that? How would you explain that? How do you explain that?
Yeah, absolutely. And hi, how are you? Yes, we did have a conversation next week, but guess what happened since our conversation? The CDC issued a new guidance recommending that those that are over 65 also get vaccinated within this phase 1B that we're going into. So phase 1A, the initial campaign of this vaccine, we're trying to address the frontline healthcare workers, residents of long-term care facilities, which were being vaccinated by CVS and Walgreens. Those that wanted to get vaccinated, and all the residents that reside at these long-term care facilities have all achieved the first dose, and then also medical first responders. They had to register into a vaccine administration management system, also known as VAMS, and then they get vetted. Employers uploaded the rosters, and then they got vaccinated and made appointments to clinics that were within the community that they wanted to. They type in their zip code, and then all the clinics in that area would populate. Phase 1B, which we're getting ready to launch now, is going to consist of frontline essential workers, which is a very broad, large group of individuals. The phases, I just want to be clear, are not determined at the local level. So the phases, there was a national body that made recommendations. From the national body, the state governor, Governor Lamont, has an immunization advisory group. They convene, and then they execute and inform us at the Department of Public Health, and then to the local health, the different phases that are approved. So this is how the phases came about. Phase 1B is going to consist of, right now, it was over 75 years and older that can contact their provider and make an appointment, or starting tomorrow, 211, and also another phone number that I can share in the chat is going to activate, so that those that are over 75 and over can start making their appointments that do not reside and did not fall into the category of long-term care facilities. However, in saying that, we do have preliminary information that there's a possibility that the advisory committee did meet again, and they revisited the new guidance that got issued by CDC. So those over 65 may also fall into the phase 1B. We will get definitive answers tomorrow. The governor will be making an official announcement. So, and individuals and staff that also work and live in congregate settings, so halfway houses, recovery homes, and those are similar examples. Actually, faith leaders, pastors that are physically having services I'm so sorry. So it's late, and so my dog, he
Look,
I'm so sorry. He's like a baby. And so faith-based places of worship, actually, we are having a webinar for faith places of worship on Monday because they will fall under the category of 1B. And so it is going to be a vast number of individuals. We're going to need all hands on deck. So my hope is that we can collaborate with the alders. We're developing a sort of a door hanger so that we can start doing outreach in the communities that so that we can do outreach in the community of how people can enroll to get access to the vaccine. Because for us, equity and access is a priority. And we know that communities of color, our Black and Brown communities, have been greatly and vastly impacted at greater numbers than other communities. And so I definitely am hoping that this can be an opportunity that we partner together and start increasing outreach to your constituents. And stay tuned, because we're still trying to design the door hanger so that we can start really getting the word out as fast as we can, because in the next few weeks, we're going to see an increased number of vaccines delivered to the state and then to us locally once the inauguration happens at the federal level.
okay. All right. Thank you.
Okay. Anyone
I'm
else?
very detailed with my answers. I'm sorry.
That's fine. No, that's great.
Madam
I'm
Chair,
mesmerized.
I see Alder Rodriguez on the queue.
Okay, very good.
Thank you, Alder Crespo. So, Director Bond, you actually touched on, I have two questions. You actually touched on the door hang. The question, that was one of the questions I wanted to ask you. First of all, that we have a lot of seniors that are not on the internet. And so how do we get to them in our communities so that we can ensure that our seniors, our vulnerable residents are able to get this vaccine as quickly as it's rolled out, so we don't want to miss anyone. So absolutely, if you can keep us posted on that and these door hangers. And for those who are going to need to register and they don't have a computer system or they don't know how to use it, how is the city planning to be able to assist folks? Do we have a phone bank that can be done? That's one question.
Registration is going to be a couple of ways. Enrollment through the Connecticut VAMS, which is not optimal for many of the communities that really needed it in this phase. So 211 is going to be activated. The vaccine appointment assistant line phone number is 1-877-918-2224. And this will go live as of tomorrow. So as of tomorrow, many of the seniors can start making their appointments. But the first step is especially those that are over 75, they have to contact their primary care doctor first, because they may be able to get so like if they say, for example, they are a patient of the community health center, they can make an appointment with their own community health center. They don't need to go through any portal or call 211. If they have a private primary care doctor, they can contact their primary care doctor as the first line of effort. Only if their primary doctor does not offer the vaccine, then will they need to try the other alternatives, which is the online registration or calling 211 or calling the 1-877 number.
Okay, thank you for that. And I'm quite sure that if they do get a hold of their primary care provider, the primary care provider will explain to them the benefits and the risk of taking the vaccine, because that's going to be a bigger, a needed conversation. I too work I work in the hospital, and there are some employees that for concerns of the vaccine is too soon or they don't feel comfortable, some of them are turning it down. So we have to be able to give, especially our New Haven Brown and Black communities, the proper information so that they are not fearful. The last question is, you mentioned that the Moderna is going to give you immunity for 1 year. Now, is that immunity after you get the second dose?
After you get the second dose, and really the protective factor is like about 2 weeks after the second dose. And so it is important that is out there. So one of the things that we developed, because Alder Rodriguez, you raised a really good point about truths and myths and how do you make this decision. So we've developed, we have a risk communication planning committee that involves a number of stakeholders to make sure that it's the literacy level is appropriate. What are the truths and myths? Because we need to be consistent with messaging. And we also want to make sure that people have the autonomy to make their own individual health decisions. We're not looking to force anyone to get a vaccine. That is definitely not going to happen, especially not from my mouth. I want to make sure that we just give you the information you need so that individuals can make their own decisions if they're ready. Those with medical conditions definitely should consult with their doctor, because everybody's individual health is definitely complex. And so people really need to be talking to their providers about whether this is the best viable option for them.
Okay, thank you so much for that information. It's just getting it out there because, like I said, even healthcare providers have concerns in the hospital. And so, we have signed up and we are frontline workers. And definitely, I think there's a lot of fears in regards to, could I have a reaction, not a reaction, but you answered that the doctor will hopefully quell those fears. So thank you so much for that.
You're welcome.
Madam Chair, I thought I saw the hand of Walter Santiago. Maybe that was just me. Nope, he said no, so he's all set. But so far, I don't see any further hands raised. So I guess I'll throw myself in the queue, if that's okay, Madam Chair?
Yes, and then I would like to come in after you.
Thank you. So I just wanted to ask Director Bond, because I know that I appreciate the information, because it makes sense now, because I also had the same question. If you get the immunity after the first or second dosage, and then once you get that second vaccine, is it a year from the time that you take the vaccine, or is it a year from the time that you got the first dose?
It's after the second dose. However, I do have to add a disclaimer, because it raises a really good point. So we still have to follow. So I'm vaccinated. I received my first dose December 28th, right? So my second dose is like in less than 2 weeks. So and I'm planning to take my first vacation officially in February. However, what we have to understand is that we still have to follow the same precautions, because we're not going to get to herd immunity just yet. The scientific models are suggesting that it takes about 60 to 70% of the population to be vaccinated to get to herd immunity. So we still have to follow the same precautions, wearing your mask, social distancing, washing your hands often. So I do want to just add that disclaimer that although we'll be vaccinated, most of us will be vaccinated, many of us are making that decision. It doesn't mean that we could just be careless and just be walking around without following precautions.
Right, I appreciate that. I guess my question still remains: once you get the second vaccination, does the year count from? So
the second dose.
Second dose. Okay, perfect. That's it for me. So, Madam Chair, I yield to you.
Okay, I'm going to yield to Alder Furlow and Alder Wingate, and also Dr. Okafor just joined us on the phone. Okay, Alder Furlow, I yield to you.
Yes, thank you, Madam Chair, and good evening, Director Bond. I was told that the seniors at Prescott Bush, which is a Glendower property, and I'm just reading a text message that I received.
Okay.
Thought I would just take advantage of it so you wouldn't have to receive another phone call. Have not yet received vaccinations. They said that they reached out to the housing authority about this. Mm-hmm. And they said they would like to do on-site vaccinations. Mm-hmm. And so what do you advise, or what should be done?
So this is an independent senior and persons with disabilities complex, correct?
Mm-hmm.
Yes.
So they can contact their provider. They don't have to wait for housing authority. So if they do want to have a clinic on site, they can certainly partner with a community health center or the health department to do so. However, those that are over 75 and potentially over 65 after tomorrow's governor's press conference, individuals can contact their provider or 211 or that 1877 number. They don't have to wait for housing authority to organize a clinic.
Okay, anyone over 65 can call 211.
As of tomorrow, As of tomorrow morning, it's still over 75 unless the
75.
governor makes, yeah, the governor is going to have his press conference at the end of the evening, but starting tomorrow, I would recommend that people contact their primary care doctor first, just to ask if their doctor has it, make an appointment with their primary care doctor, only call 211 or the 877 number if they're not able, if their provider is not going to offer it. Many providers are going to offer it, but you still have some that may not have it.
Okay. Glendower is not housing authority, is it?
It's, yes,
It is housing authority, isn't it?
yes, it's the
Oh,
same.
yeah, yes, Director Bond, that is housing authority.
Mm-hmm.
Yeah, but that's what I said. It's still independent living. So it's not like a long-term care facility where individuals have no mobility. People can still have the autonomy to schedule their own. They don't have to
I
wait.
get it. Okay.
Yeah.
Yep.
They don't have to wait for housing authority to organize a clinic.
Okay, I get it. Thank you very much.
No, you're welcome.
This is all very
Hopefully
complex.
I'll see
right?
you. And hopefully
Yes,
I'll see you on the Monday call.
Yeah, we're going to, and if I just may add just one final comment, Madam Chair, we are going to be organizing a briefing with you and the full Board of Alders very soon, as we can get our dates together with your office.
Okay, thank you. Alder are you finished, Alder Furlow?
Yes, ma'am. Thank you.
Okay. Alder Presco, did you see Alder Wingate 10, and then we have Alder Hunt?
I think Alder Wingate would be next, followed by Alder Hunt.
Okay.
Oh, he was reconnecting, I think.
Alder Wingate?
He was reconnecting. Oh, there he is.
My apologies, my battery died. Can you hear me?
Mm-hmm.
Oh, it's good to see you, Alder Ernie Santiago. So maybe I missed it, but when will the city officials be able to get the vaccination?
Under phase 1B. So as of next week.
Phase 1B, where would that location be?
So when phase 1B gets activated, it will be an email alert through the VANS system, and you will make your own appointment that's convenient for you.
Okay. All right. Thank you, Director.
You're welcome.
Madam Chair, I think Alder Hunt was next.
Yes. Alder Hurt?
I didn't have my hands raised. I didn't.
Oh, I'm sorry.
That's okay. I was trying to figure out who was Alder Hurt. I mean, Alder Hunt. Okay.
Alder Hurt, you know that was you.
First of all, I would like to say before I ask my question, Dr. Okafor, do you hear me? Okay, thank you for coming with us tonight. But to Director Bond, I would like to know, what's the number, the 877 number?
I know I was trying to put it in a chat and then realized we don't have a chat.
Madam Chair, I was going to suggest that she send that information over to Al Lucas for that to be disseminated to the Board of Alders.
Okay.
Oh, I'm sure she will. I just wanted it for me.
Yes, ma'am.
If you.
No, absolutely. Let me pull the number right back up. Hold on one second. I took the number down.
Yeah, and while you're looking for that, I have some questions. You know, people that has been talking to me, my constituents, they were afraid of it, you know, hearing things, media about would it affect our DNA? Would it hurt us? How would this affect us?
So so let me give you the number, and then I can, we can talk about some of our risk communication strategies to try to reduce the vaccine hesitancy and the misinformation that's out there. The vaccine appointment line. So there's a couple of ways. There's the vaccine VAMS that can be the link that can be found on ct.gov VAMS. There's 211. And then the vaccine appointment assist line that will activate as of tomorrow. It's 1-877 918-2224. And that's for 75 and over for tomorrow.
Okay. Because I want to say sometime the 211, they are very loaded, they are full with so many things sometime. And so I just wanted a direct number for my seniors. But I think,
Absolutely.
yes, who live in their
And
homes.
yeah, I know, I understand completely. And we have a lot of seniors that live independently, and we want to make sure that they know how to get access to the vaccine and get protected. One of the things that we've developed and we created, and I sent it over to Alder Morrison, so I can also share it with Al Lucas. We developed truths and myths about vaccines and what's the information that's out there, because there's a lot of misinformation. And so we can share that with all of you so that if you want to promote it in your social media outlets, we can also print them if you're going to be seeing constituents in the community. But we want to make sure that community members, are aware of, the vaccine is safe. It had successful clinical trials. It had diverse group of individuals that participated. And it is safe to take the vaccine. And so we definitely can share that information with this group.
Okay.
But-
Dr. Okafor?
Yes, Dr. everyone.
Okay.
Happy New Year
Happy New Year.
to everybody.
Yes, we would like to know if also we want you to also answer some of the questions as well. So,
And Madam Chair,
ask-
I wanted to also let you know that there are two hands up as well for Alder
I see
Santiago
them
and
now.
Alder Rodriguez.
Yeah, Al just told me, he just helped me with it. Yes, I see the two hands. Okay, it's in your ball court to tell them. I think it was Alder
Santiago.
Santiago, yes.
Thank you very much. I'm just want a clarification, even though we still got to be cautious, use mask, clean hands, all that. But Alder Crespo asked a question and about when the year starts. And if I remember correctly, you said before that the vaccine takes effect 2 weeks after the second dose.
It takes about
Yeah. So the year actually
Yes.
starts 2 weeks to the second dose, not on the second dose. Am I correct?
In order for the vaccine to be fully effective is about 1 to 2 weeks following the second dose to be really fully vaccinated.
So that means the year starts after the week and a half or 2 weeks when it's fully effective?
Fully effective. No, not fully effective. Yeah, fully vaccinated and protected for a year after that. Correct.
Okay, so it's not after the second shot. It's after the week and a half or whatever when it becomes fully effective.
Yeah, it takes about 1 to 2 weeks after the second dose. Correct.
Yep. Yeah, I get that.
And,
so the year
and that's
starts
just the
then.
Moderna vaccine. So I just want to be clear. That's just the Moderna vaccine.
Yeah, because I'm going for my second dose, so I just want to make sure it's 2
You
weeks.
did?
after.
Which
All right,
one did
thank
you get? Which vaccine did you get, sir?
The one they're giving in the Cornell Scott Health Center.
We got the
Moderna. Moderna. Okay.
Moderna,
cool.
yeah.
Yep. Awesome. Well,
That
congratulations.
was my clarification. So, yeah. Congratulating the second. Thank you. Appreciate it.
You're welcome. Do you mind sharing if you had any side effects? I'm sorry, I have to ask.
Oh, no. I feel great. Nothing, no pain, nothing, no.
Good. Well, I might need you for a video testimony.
I got pictures when they vaccinated me. So I got pictures.
Oh, do
too,
you
so.
mind sharing it? Do you mind? Do you mind sharing that so I can promote you on Twitter?
Yeah. I got no problem. Yeah.
Thank you.
Yeah.
Alder Carmen Rodriguez.
Yes. Mm-hmm.
Thank you so much, Madam Chair. And my final question is going to be, I know that you mentioned the door hangers so that we can get out into the community. Have we discussed that in the event someone is uninsured, underinsured, Is there going to be provisions for that? Because we do have a lot of families that are uninsured. I want to.
Yeah, that's a great question. So we want to make sure we emphasize that the vaccine is free to the individual. There, at no point in time should anyone be asked for a social security number. Apparently, there was some scam already trying to arise from, and it's unfortunate that there's always, scams that arise from anything that good comes out of something. And we want to emphasize the vaccine is free to individuals. We will ask for your insurance if you have it, just so that we can try to cover some administration fees. However, we will not charge for a copay. We will not charge for, if anything, if the individual does not have insurance, we would just continue on in providing the vaccine to the individual.
Okay, and to add to that, so you just mentioned that you might charge the administration fee because if vaccines are coming from the state and they might be from the VFC, I'm not 100% sure, then it's an administration fee that is charged to our insurance. But then we also have to double check that if that family has a co-payment, we need to have that clarification because someone
no co-payment.
Okay, wonderful.
We cannot charge co-payment.
Okay, but there will be an administration fee so that is out there for the individual to know. So that's the question. And underinsured, there will be no admin fee. It will be free of charge.
Yep, it's the vaccine has to be for free, just like for COVID testing. Same
Okay,
rules.
thank you so much. I just wanted that clarification so that once we get out and do our due diligence, that we give the correct information. Thank you so much. Thank you, Madam.
Welcome.
Madam Chair, I notice Alder Edwards as well as Alder Douglas.
Yes, Alder Kim Edwards. Yeah.
Thank you. Sorry I was late to the party, and hopefully I didn't miss too much. I do think it's awesome, the myths versus facts. We were talking about that yesterday, Alder Clyburn and I. But I did have kind of a general question. And I'm assuming it's going to be a case-by-case basis, but people with underlying health issues, I'm like, say I have lupus, I have systemic lupus. And I typically can only take kill vaccines versus live vaccines. With the COVID vaccine, is that something I would be eligible for, or is that something I would need to talk to my provider about just because of my underlying condition?
So that's a really good question, because that's a common question that as we've been doing webinars in the community, into different, well, not just the community, like healthcare workers, first medical responder, that question continues to come up, and that's part of the true and myths. So persons with like HIV or other immunocompromising conditions, or who have to take immunosuppressive medications or therapies, might be at greater risk to COVID as it is. So we have to outweigh the risk of COVID and the risk of the comorbidities that individuals have. So yes, it will depend. It's not a live vaccine. The data does not suggest that there's an issue around safety of and having a contraindication. And so they still may receive the vaccine, but what we recommend is that individuals get counseled by their provider to making sure before they make that decision, because you want to make sure that if there's a treatment that is that someone is taking or things of that nature, that it doesn't contradict with anything that might be in the vaccine.
Okay, thank you. I have no further questions.
Alder Douglas.
You're welcome.
Yes, thank you, Mr. Chair. So I haven't heard anything about the security, the measures of security as far as protecting the doses themselves. Where are they stored? You know, and what kind of security do we have to protect them?
Do we need security for vaccines? No, I'm just kidding. Listen, the demand is higher than the supply. The demand is definitely higher than the supply. I can tell you that. And that is actually surprising. We were really surprised. I know it was really nice to see that in different communities, when I go out and I'm talking about flu, people are like, no, we want the COVID vaccine. And these are communities of color. So I'm happy to know that our Black and Brown communities are ready for the vaccine. So despite that, there are some that do not want to, and they have the autonomy to choose. And we want to make sure that we provide consistent messaging. But our vaccines are supplied, are secured in our clinics. We have, alarm symptoms, alarm systems, and the alarm systems can trigger and notify and will activate the 911 dispatchers for us to be notified. So definitely secured. Hospitals are
Okay,
securing their own supply.
just curious. We got people who put pins and needles in children's candies. So we got some nuts out here.
Yeah. Listen, our nurses are protecting these vaccines like nobody's business.
Okay. All right. Well, that's good to know. Thank you.
Madam Chair, I don't see anyone else with their hand raised, so I'm going to throw myself in the queue. And I just wanted to let Director Bond know that I too took the vaccine, the Moderna. I will be taking my second dosage in 2 weeks, my second vaccine.
Nice.
And the only symptom that I got was that after 9 o'clock that evening, I feel a little sore, but that's it. There was nothing. There was no discoloration. There was no symptoms of headache or anything like that. It was simply just a little bit of soreness, but it was gone the following day.
Oh, wow. So do you mind sharing a picture? Did you take a picture as well?
The nurse took a picture of me. Yes. Yeah, of course.
Awesome.
I can send it to you.
So that was my side effect. So if I can share, my side effect was exactly like Alder Crespo. I ended up the next morning I had soreness at the site of infection, like if I had a flu shot. That happens to me when I get a flu shot as well. But other than that, I did not get any other symptoms. However, I spoke to a state police officer this afternoon who was trying to figure out how to enroll their father, who's 75. And I asked about their vaccine experience, and that individual actually felt like flu-like symptoms for 24 hours, and then the next day felt completely fine. So everybody's body will react differently. But for the most part, especially with the Moderna vaccine, I've been hearing really great, really minimal side effects, like just soreness to the site of the injection, which is actually good news.
Yeah, so I just wanted to share that. And Madam Chair, I don't have any other comments, so I yield back to you.
Oh,
thank you, Director Bonds.
So thank you, Director Bonds, for your time and answering our questions. I have one more about say if a family member, have you one would take it and one refuse to take it, and they live in the same house. What I still will be protecting a person who don't want to take it, and I'm still protected because I took it, correct?
Yes, you are. That's my situation right now. So my two kids, I have two boys, two young men, they're in college. Neither one of them are vaccinated. I didn't get my second dose yet, but because there are my immediate household, so we sort of still have a small level of risk because they're out having their little part-time jobs, and so they still can get exposed. But once you have your second dose, in about 1 to 2 weeks after your second dose, you should have protective factors.
Okay. Also, like the elderly, have you, I'm just saying, just in case they have a reaction and they're home alone, I wonder, I'm just concerned about that as well.
So the scientific data for like any adverse events is to monitor 15 to 30 minutes after the vaccine, depending on if it's Pfizer or Moderna. We observe you for 15 minutes after you get vaccinated at our site, and then instruct individuals to make sure that they're able to contact their, call 911 if they feel any type of ailment. We luckily across the country have had very minimal severe reactions. And so it is our hope that individuals, we do instruct them to call 911 if they start feeling any type of risk factors. But you do raise a good point. I'm wondering if we can work with the different elderly management facilities to make sure that they sort of monitor their residents,
Mhm. Okay.
because that is a good concern if they live by themselves.
Mhm. All right. Thank you. Thank you so much.
You're
Dr.
welcome.
Okafor, thank you for joining us tonight. Um, we also asked this question, and I want to ask it to you as well. Um, that people are very concerned. It's a myth, hopefully, that this vaccine would not really hurt us in any way. Um, I just want to know what you, from your level, have heard or people have asked you about it.
Okay. I believe it's great to hear all your voices again. Very nostalgic, and I hope you all are staying safe and well in New Haven. So, Other Claiborne, thanks for inviting me. Director Bonds did a fantastic job. So it's good that she is there and she's answering the questions, and she will respond to our residents when they come up with any questions. From my perspective, as you know, I'm no longer in New Haven. I'm working at the federal office with Health and Human Services in Washington, D.C. So what I will advise everyone is remember the 3 Ws. So even after getting your vaccines, whether you have the BioNTech or the Moderna, I think Moderna is the one that New Haven is actually administering. So what I would say to you is the 3 Ws, continue to practice that. And that is wash your hands with soap and water. Don't stop because you got the vaccine. And also wear your mask as well as watch your distance. So that will protect the people in your household a little bit, preventative, at least keep the environment safer. And also, one can also get infected before you get your second dose if you stop practicing these preventative things, if you stop wearing masks, if you get exposed, if you don't wash your hands with soap and water, and if you don't watch your distance. So the vaccine, yes, gives protective factors. However, our lifestyles and hygienic practices are very crucial to keep all of us safe and healthy. So that's the only thing I will emphasize.
Yeah, that's good. I like that was good because I want, after I take my first dose, I haven't taken it at all yet because I'm one of these scary cats. But I could still get it, correct?
Before she explained, Director Bunce explained that, after your first dose, there is a 3 week interval before you get your second dose. As Director Bunce explained, with that second dose, you get 90% protection. The vaccine gives you around 90% protection. So between the time you get that full protection, remember flu is around 47%. So it's pretty good, as Director Bond said, is a good protective factor. However, remember nothing is 100%, which is why, and between your first dosage, receiving the first dose and getting the second dose, when the second dose boosts it up to get to that 90%. So between first dose and second dose, just continue to be very, very vigilant in the 3 W's, which is really wash your hands with water and soap, wear your mask, as well as watch your distance. And after you get the second dose, don't just drop everything. I mean, continue to do that because, like I said, those gaps, you don't know who will fall into the gaps. And that is why it's important for us to just keep at it and keep practicing those preventative measures. And I'm sure that Director Bonds will be able to answer other questions about the city government distribution and other things, other questions they have. I'm just coming in from this perspective.
Yes. Yeah. So, Alder Wingate, you have your hand up because I just want to make sure I got one more. When I finish my 2 doses, I'm really safe. This is to both of you. Director Bond and Dr. Okafor. Are we safe after that second dose?
And so
what has passed out there? Do you know anybody who had a second dose and they still, got COVID or?
So most people are just going to start getting their second dose because the vaccine distribution started right around the holiday of the Christmas holiday. So that around that week, vaccinations began. So most people are just getting started with their second doses. As indicated, the scientific data is indicating that about 1 to 2 weeks after the vaccine, each vaccine provides about 94 to 95% efficacy. Moderna has indicated in a recent scientific journal this week, which is recently published, that the vaccine is going to be protective within that range of 95% of up to a year. And so that is what we know as of now. And of course, as things continue, as we continue to vaccinate other individuals, continue to have research done on different journals, we'll be able to provide the public the latest information. So what we know right now is exactly what we both, Dr. Okafor indicated, as well as what we know right now. And as it changes, we will make sure that the public is aware.
Yes. And what about the children? Are they going to do in what age of children or no?
So right now, the vaccines are approved. Pfizer is for over the age of 16, and Moderna is for over the age of 18. Of course, there's other clinical trials underway. There's definitely interest in trying to increase for children. But as you know, in the data, especially in our city, most of the cases have been for higher, older adolescents and young, adults. So the vaccine was really geared and focused on the mostly impacted community.
All right, thank you. If there is no other questions from the alders, and we will say thank you tonight. Alder Wingate,
Madam
please.
Chair, Alder Wingate.
Yep. Sorry.
No, thank you, Madam Chair. I just wanted to personally say hi to Dr. Okafor. I just wanted to say hi and Happy New Year. That's it.
Happy New Year to all of you. It's so great to hear your voice.
Oh, it's good to hear your voice as well.
I don't get to participate in friendly meetings like this in Washington, D.C., although most of the time it's friendly, but it's quite interesting there.
Right. Oh, it's very interesting there right now. Hopefully they did the right thing today.
Madam Chair, I think Alder Hunt, whoever that is.
Oh, no, Hurt.
I'm just kidding.
Oh, okay. Oh, I'm sorry. Okay. All righty. I'm not really with
I'm sorry. I had to do that.
Okay, so I do want to say thank you to our guests. Thank you again, and thank you.
Thank you. You all stay safe and stay well. Hope to run into you in New Haven one of these days.
Absolutely.
Alder, Chair.
Bye-bye.
Bye-bye.
Dr. Okafor. Oh, man. Okay.
Oh, Dr. Okafor, she left?
She left.
Hey,
She
I'm
man.
left.
here. I'm
Oh,
here.
Oh,
hey,
Jeanette
Dr.
Morris.
Okafor. This is Alder Jeanette Morrison. I'm gonna be call.
Oh,
Hi. I'm
how
gonna
are
be
you?
calling you. I
Okay,
just,
no
I just,
problem.
okay, about our program for next month for the Black History program. Okay.
Okay, no problem. You
Okay,
all
great.
stay safe.
Okay,
All
you
right.
too. Thank
Bye-bye.
you. Bye
Thank
bye.
you.
Okay. All right. Thank you, everyone. We want to, I just want to quickly just read some cards because I want to let you know that our president, we sent out 1, 2, 3, 4, 5, 6, 7 cards. One to our Alder Abby Roth, Alder Anna Festa, Alder Santiago, Alder DeCola, our president, Walker Myers, Alder Marshawn, and Alder Wingate. And we were great. This was a great time to support the people who support us. So we were, and we, our love go out to you. And just to have to go through this part of life, it hurts a lot. I'm talking, that's from me. But um, our president sent her thank you for us supporting her with our love and our donation to her in her time. And also we have a card here from Alder Roth, and it says, "Dear members of the Black and Hispanic Caucus, thank you so much for your thoughtful gestures to send a card and check," she said, "and thank you in memory of my mom. So my mom, I so wish that that many alders have not recently lost loved ones. Your doing this is a great way to show support. My husband and I just made a donation to the New Haven Reads using the money which you have sent. My mom cared deeply about kids and education and would have liked knowing she was helping such a vital organization in New Haven. Thanks again, Alder Abbey, for your kindness." Also, we have a card from Alder Mashan. "Thank you, dear colleagues. I am deeply grateful for your words and comfort and condolence. They mean a great deal to me doing this. My first holiday season since my father's passing in July, and I will be certain to honor his memory in contributing to one of his favorite causes." Also, we got a thank you from New Haven Scholarship Fund. And it said, "Dear friends, your generosity donation means so much to our students. Thank you again for your continued support. By your generosity, gift, and have encouraged a young person to participate in educational experience that would not otherwise be possible. Congratulations to, contribution of the contributing to the New Haven Scholarship provides critical first step stones on the road to productive and rewarding future." Thank you. And I would like to say to us, You know, we are doing something really great by helping the young people take that first and those first steps towards their education. So I really appreciated that. Um, just to remind us how much, you know, we do care for our community. Also, we got a thank you from our kids, and it says, I want to extend a heartfelt thank you for your commitment and past generosity to our kids. We work hard and apply every available resource to fulfillment of our mission to promote permanency, safety, stability for vulnerable children and their families. So I thought that was nice. It makes you feel happy that people are grateful for what the Black and Hispanic Caucus has done.
Madam Chair.
Brian has his hand.
Yeah, I didn't send a card.
Please forgive me, Alder.
I didn't send a card, but you know I'm a hugger. I'm
Thank you.
I'm the guy that, you know, gives the bear hugs out of love and you know, personal stuff. You know, see my oldest at here, I go give him a pound, stuff like that. I'm not the really like the card person. You know, I'm the person that try to show and love in action. So, you know, me being here tonight is my action to say thank you.
You are so welcome.
You know, it's been a difficult month for not just me, but a whole lot of people. A lot of turmoil and chaos in this world. And just to get a card, because to be honest with you, the card was worth more than the money to me. And I want to say that again, the card was worth more than the money in reference to the words that came off the card. And I believe that you mean those words, Black and Hispanic Caucus. I believe you mean those words. So don't get me started, right? You know what I'm talking about? Listen, all the you know, majority leader and the only one can preach on this Zoom call tonight now.
I
know. You know that? Don't you start nothing. Come on. Holler at the church, say amen. All right. So no, truly, thank you so much. You know, oh, I forgot. All the hurt over here too, you know. He can go too. So you know, no, for my family, to my family, to the Black and Hispanic Caucus family, I just want to say thank you for the card and love. Thank you so much.
You're so welcome. Also,
the chair.
Yes.
I will say thank you too, because I also received a letter too, the card. From the bottom of my heart, I thank everybody here. Thank you. And remember, it's hunt from now on, not hurt.
Okay, well, we were so grateful, the Black Hispanic Caucus, to make sure we show love to all of you. And we're grateful that we could do that. And also, just a few things. Our bylaws, we're gonna go over them next month. Al will send the bylaws to our secretary, Alder Kim Edwards, and she will make sure that we get them. This year, we want to start out right and following our bylaws and doing what each one of us should be doing to strengthen the Black and Hispanic Caucus and really participating. And also, Audrey Kim Edwards, she sent out to all of us a email asking for us to be a part of what issue you would love to do, to take on. And so I'm going to let her share that email with you that she sent to us. I know I received it and said what I would like to do. But you want to share first, Alder Kim Edwards?
Thank you, Madam Chair. I just want to give you all the heads up. everyone may not have received it because some of the emails have been kicking back. So what I'm going to do is I'm just going to resend it. So look for it in your email tomorrow. I'll send it to your personal, if I have your personal email, as well as your Word email, for those I have a personal email for. And I'll follow up with everyone just to make sure they received it by the end of this week. So just look forward to receiving a beautiful email from myself.
Yeah, so we're going to go to work. Alder Furlow had said, we are going to go to work this year. We're starting out right. And we will take on issues and follow them through. Also, one more thing before I ask Alder Morrison to come back to give us a little update on the Q House is our annual events of our Black and Hispanic Caucus. We are now, I'm asking you today for next year and then the continual of this year. For January, who would like to be over the support of the Three Kings Day and Martin Luther King program from the Black and Hispanic Caucus. February with this year, our Alder Morrison let me know she want to continue to take care of the Black History program for February. March is our HBCU program. She expressed that she would like to continue, but the floor is open for if you want to. That's why I'm going over these. April will be the caucus state of address. Hopefully I won't be out this year. Last year I could not, I could hear everybody, but I couldn't see everybody, and you couldn't see me. And June, we have Juneteenth program. September, we have the Hispanic Heritage program. And October, we have the gala. And then December, we'll be back to Kwanzaa. So it's open for any alder if they will love to take any of one of these items and want to work on them and be over those, they can.
Madam Chair, did you mention Three Kings?
When I first started, I said January support for Three Kings Day and Martin Luther King MLK programs.
Okay.
Okay, so if you would love to do one or whatever, how many or whatever you want to do, send our secretary, Kim Edwards, an email and she will take care of that. Alder Hurt, did you have your hand up? Okay.
No, ma'am.
Oh, all right.
No,
One
ma'am.
more thing, and then we're gonna go. Is we didn't hear from Alder Morrison about the Q House to give us updates on that. Alder Morrison.
Hello.
Okay, Alder Morrison about the updates on the Q House.
Oh yeah, I'm sorry, my thing went off. So real quick, I also wanted to mention that when we were talking about the suspension of the dudes, the secretary, Alder Edwards, will be sending out each member who owes anything for 2020, what their remaining, not just 2020, all your remaining balances. And so I'll be working with her over the course of the next couple of weeks. And so by the beginning or mid-February, everyone should know how much they owe. If you don't owe anything, you won't get an email. But if you do, she'll send it out. So in regards to the Q House, again, thank you guys for always supporting whatever steps we need to make in order to make it happen. As you know, the building is coming up. It will be ready to open come June. We had an RFP for the management of the actual building. We are currently in talks of a contract with an entity. We had 15 different persons and entities look at the application. We had one submission. That submission was, I don't want to say the submission yet because we're still in contract negotiations, but we had one submission and we're trying to put the contract together. Hopefully next month I can come back and tell everyone, where we are. The other thing I wanted to say about that, we still have our Q House Legacy Brick campaign going on. I know I've set that date, the deadline date 1,000 times, but this time is the real date, March 30th. They will be closing out your abilities to buy a brick. So I'm gonna make sure that Al, he sends out an email that has the link to it. It's $100. You get 3 lines on your brick. You'll design your own brick and you get up to 20 characters per line. And so that's that.
All
Any
right.
questions?
So, yeah, any questions? If not, I would like to just say, I think I want to be a part of this history of the Q House and hurry up to get my name in and what I would like to say. So when I'm gone and when I went to be with Jesus, they'll say, oh, I remember that old lady, Alder Clyburn. All righty.
Madam
So
Chair?
our next is, pardon me?
No, never mind.
Okay. If there's nothing else, and just remind us that the bylaws will be coming out to you from Alder Edwards. So you could just go over them. And if there's nothing else, our next meeting will be February the 10th, 2021.
Madam Chair,
So,
motion to adjourn.
yes, so you making the motion and I second it. Okay, you are adjourned.
All in favor?
Aye.
Yeah. Yeah.
Good night, guys. Be safe.
Good night, everyone.
All right.
Be safe.
Good
Good
night.
night,
Good night, everyone.
Alder, good
Be
night,
safe.
Alder Hunt.
On the Wingate.
Thank you, everybody.
Later, my brother. You know what I'm saying? Next year. Next
On the
year. That's
time.
like next year.
Hey,
Next year.
it is what it is, man.
Next
You
year.
almost got in. You almost got in.
Listen, we beat the Cowboys. That was half of the Super Bowl.
You
That's all we
almost got
needed.
in, but
Hey,
the
yo, check
Eagles
this
play you
out.
30, man.
Listen, Ernie, you know what my car looked like? You know what my car looked like?
You what?
My car.